Hello and welcome to The Nest. My name is Vivian Ndegwa and it's a pleasure to have you on board. Now today we have a very informative conversation, a conversation that should be had, and that is on diabetes. Yes, our focus is on diabetes, you know, how to get to manage this condition, everything to do with this condition, the prevention bit of the condition, and maybe just the importance of early detection. And joining me just to get to dissect this topic is one Dr. Rosslyn Ngugi. She is a consultant physician endocrinologist, and she is also the chair of the Kenya Diabetes Study Group. Welcome to the program.
Thank you, Vivian, for having me.
It's a pleasure having you on board. So maybe we can just begin by getting to define what diabetes is so that we get into deeper into the conversation. So how do we define diabetes?
So diabetes in layman terms, diabetes mellitus, because there are different types of diabetes. In layman terms, it's a condition where you have excess glucose, which the body cannot be able to process. And because of that, it then is retained in the blood, and that is the one that gives you the complications. Sugar itself is not a problem. Blood glucose is not a problem.
Okay.
And when the body cannot be able to process it, that is what we call diabetes mellitus. It is a condition which is characterized by deficiency of a certain hormone your body produces called insulin, which helps process this glucose and push it into the cells. So when you have deficiency or if there's a bit of resistance, then you develop diabetes. Yes.
There are two types of it. Kindly just take us through the two types of diabetes.
Actually, let me correct that. There are several types of diabetes.
Wow, I know
currently, so it's good at least you know two.
Yeah.
You're doing very well. So the different types, if you're born by the age of 6 years and you do not have any insulin to help process this glucose, that is called type 1 diabetes. And such patients actually require insulin from a very young age. You've seen children as early as 6 months to as young as 6 years developing type 1 diabetes. But what we've realized is this condition can even appear in an 18-year-old. Okay? And there's type 2 diabetes where here it's a very strong family component, and that's why whenever we have our patients, the first thing we ask is, do you have a family history of diabetes in your parents, grandparents, aunties, uncles, any extended family member, because it tends to be inherited within the families. And typically you have some degree of insulin, it's just not sufficient to be able to help process the glucose, and so because of that you develop it much later, from as late as 40s onwards, but typically around the age of 50. Now other types are called gestational diabetes. That's diabetes occurring just purely because of pregnancy. We're finding quite a number of pregnant women, when they reach 7 months at 28 weeks, we subject you to a test called oral glucose tolerance test. And what happens is we discover your blood sugar is actually elevated, and that portends a risk to your unborn baby. What is interesting is you do have a family history of diabetes, and they do progress throughout the pregnancy with some complications, minor ones, but they have major implications on the baby, and that's why we test for it. And after you deliver, actually the diabetes goes into remission. However, if you have a very strong family history, we'll continue to test you for up to 6 weeks, and thereafter every 3 years, just checking to see whether you'll develop diabetes. Another type that we learned is following some infections like COVID-19 made people who are genetically predisposed to develop diabetes cause you to have diabetes. The other patients who have cancers, they can actually predispose you to developing diabetes, and even treatment. One of the commonest drugs, very cheap over the counter, is steroids. You'll hear most of the relatives talking about PDL. It's a white tablet that's sold over the counter, and before we used to use it for the management of asthma. Later on, if you use it for a long time, it puts you at risk of developing diabetes and other non-communicable diseases like hypertension, cholesterol, obesity. So it can also be caused by drugs. So you can see there are quite a number. And even as we go along, we are discovering just that there are actually much more than we realize, several types of diabetes that are making us think we shouldn't stick to just the conventional type 1 and type 2, because based on that we can then tailor how we will manage your diabetes.
Yeah,
Yes.
that's interesting. Some new information there.
Yeah.
Now, when we talk about all these types of diabetes, what are the causes? Because from what you've mentioned, genetics and,
Yes.
it being hereditary is one of the maybe causes of it. That's for type 2.
Yes.
And the gestational one as well. What are the other causes of diabetes? Maybe if we can begin with type 1.
So type 1 is actually a genetic disorder,
Okay.
okay? Although it doesn't tend to run in families, what happens is you actually have a genetic defect that does not allow you to produce insulin, and because of that you are dependent on the insulin injection. So what we found is that there's actually an environmental trigger that now triggers what we call an autoimmune reaction. What is autoimmune? It's your body actually attacking itself. So supposing you get a viral infection, and then as the body is trying to fight this infection, you develop what we call antibodies that then go and attack this pancreas. And because of that, we are able to test and see, are you type 1 or type 2? In type 2, like I've told you, tends to be familial. And other things we've noted is some conditions like polycystic ovarian syndrome. For women, if you find a woman who's really struggling to lose weight, she's exercising, she's watching her diet, but she's still putting on weight, she's not able to have children, you find she's not actually having her regular periods, she gets them once in 3 months, start thinking, could this be diabetes? Like I'd mentioned, there are certain drugs, both chemotherapy and even some antifungals that you can be given, and steroids that can actually induce the development of diabetes with time. Then there's also infections. If you have a very severe infection, you've heard of people who drink quite a bit of alcohol. So chronic alcohol ideally would damage the liver. But what we found, it also causes inflammation of the pancreas, which is the organ that produces insulin. So we're finding a lot of people who have alcohol abuse disorder ending up with pancreatitis. They keep on at it, it destroys that pancreas, they end up with diabetes. So practically anything nowadays can cause diabetes, especially if you have a strong family history. So one of the things we always urge people is, can you sit down with your parents and actually find out what are these diseases that run in the family, and we start preventing them early. If you know that your father or your mother has diabetes, start screening early, exercise regularly, change your diet. It will actually prevent you from developing diabetes.
Yeah.
Yes.
We'll get into what to do in order to prevent diabetes.
Yes.
But probably we can just talk about the early symptoms for one to get to know or be alerted that, okay, probably I might be having diabetes. What are some of these early symptoms that one should be alert on?
So some of the symptoms that you'll get is you get excessive thirst. So people have always thought, in the hot season you find yourself drinking, but there's always that one family member who takes 8 to 10 glasses of water. If you find yourself taking more than 4 liters of water, and because of that you're constantly passing urine, at night it wakes you up. You have the elderly patients, because of an enlarged prostate, they always wake up, but then you're a young person, you're waking up 2 to 3 times just to pass urine. Those are signs of diabetes. If you notice that you're having a problem with your vision, before you didn't have issues, but then you're driving in traffic and you can't quite see. If you're a student in school, you cannot be able to see the blackboard, then that gives you a clue. Now remember, I told you needed glucose to function. When your body doesn't have glucose, it starts breaking down the fats. So you find people with weight loss that you can't explain. We call it unexplained weight loss. We didn't try to lose, but you lose up to 10 to 15 to even up to 30 kgs, and you can't explain the weight loss, then that could be the reason. Then you find yourself getting recurrent flus. Every time someone comes, they're always getting flus, diarrheal infections. Your flu becomes pneumonia while everyone else has recovered. For women, you find yourself at every contact. Supposing you're married, after every sexual contact, you find yourself getting recurrent urine infections. And even if you don't have any contact, recurrent urine infections, recurrent vaginal infections, recurrent stool infections. That raises a clue that maybe your immunity is suppressed because of the diabetes. Why don't you check for diabetes? If you find you have symptoms of your heart beating suddenly, and yet you had been stable all the time. You're getting tired, you're constantly tired. You wake up tired, you go to bed tired, you can't concentrate in school, at work, go and have your sugar tested. That's likely that you're developing symptoms of diabetes. It's the common things. It happens and you're actually seeing it, but then when you don't put it into context, that is why you're not able to pick it up early.
Yeah, some of the symptoms you've mentioned feel so common, you know, like a flu. I was just telling you before we got to start the show that I get flu so many times. You know, sometimes when we listen to or when we read about symptoms of a particular maybe condition or disease, you happen to almost find you ticking all the boxes, you know, all the boxes rather. So how exactly is it detectable? You know, probably there's someone who's watching us right now and they feel like, okay, I have majority of those symptoms. So where to start from there and how is it detectable?
So it's pretty simple. It's actually one of the easiest tests. If you walk into any pharmacy, any hospital, it's a simple finger prick test that gives you an answer in 5 seconds what your blood sugar is. And we have values. If say you've just walked in randomly, regardless of the time you ate, and you found your sugars were above 11.1, that is diabetes. On the other hand, if you had fasted overnight from midnight and then you walk in at 6 in the morning to a hospital and they check your sugar, if it's more than 7, then that is called diabetes. But what we found, sometimes it's difficult for people to, you need to be absolutely sure. Then we have another test called the glycated hemoglobin, also called HbA1c. Now the advantage of this is it's a glucose molecule attached to the hemoglobin molecule. And because this rotates around in the body for 120 days, it tells us how your sugars have been for the last 120 days. If it's more than 6.5%, that makes a diagnosis of diabetes. So if you have any of these three, we are then able to make a diagnosis and then sit with you now and discuss what are the implications of having this condition.
Yeah. So before we get into the management of diabetes, either types of it, how do we go about preventing it? For the people who haven't gotten the condition, how do you prevent yourself from getting it?
So first you'd need to know, are you at risk? There's also a condition called pre-diabetes. There's a way you can also check your sugars, and if you find like random sugars between 7.8 and 11, that's called impaired glucose tolerance or pre-diabetes, or impaired fasting of 5.6 to 6.9, because there are people who like numbers. Now, one of the things we tell you is sleep. Do you know that sleep is a major contributor of producing stress hormones like your thyroid hormone, your growth hormone, your cortisol? So if you're not sleeping 6 to 7 hours, your stress hormones are being produced. So sleep well. Then let's talk diet, because diet tends to be very confusing for a lot of people. And what we say is you are what you eat. And this also goes towards management of diabetes. If you look at your plate and it's more white or brown than green, that means you have a lot of carbohydrates. Carbohydrates give you the highest percentage of glucose, up to 70%. So we're talking rice, chapati, ugali, all the things bread, your pancakes. I know I'm mentioning all the things I've seen in your breakfast. I know, the donuts, the mandazis, they're the tastiest but the worst because they have a high concentration. Let me give you an example. A slice of bread is equivalent to 4 spoons of sugar.
Just one slice?
Yes. So we say reduce, don't cut out your starch, but say if I told you to take a fistful, just one slice of bread and make it brown bread so that it's processed and takes a longer time to be digested. If you eat a chapati, then have that, half the plate be vegetables, and then 2 to 3 pieces of meat. Okay? So you have your proteins, your carbohydrates, and your vegetables. So the general idea is always have a balanced diet, whether it's breakfast, lunch, or dinner. Now another thing, the myth that was commonly said was fruits are good for you. But what we find is fruits are full of sugar. It's just unprocessed sugar. Can you believe a slice of a watermelon, just a small slice is 4 spoons of sugar?
That's my favorite.
Let me break your heart even more. You know one long banana, the really sweet one, that's 8 spoons of sugar.
In one banana?
One banana. So that's equivalent to all that sugar.
Wow.
So can you imagine if you're making it as a fruit salad? That is a lot of sugar. So we say eat one fruit a day. And then look at fruits that have what we call a low glycemic index. And then it's something that can be processed over a long period. Similar to the fats. We don't want polyunsaturated fats. Remember we used to say you're cooking oil, I don't know, maybe I'm older. Remember the days of Kimbo when it was solid fats. Those solid fats, when they're broken down, they break down into fats that take a while to be broken down. So it ends up being stored. So what we tell you is use your liquid oils, your vegetable oils, rather than your animal oils when it comes to cooking. Even how you cook is very important. Another thing we learned actually from our nutritionists, and that's why we work closely with our dietitians, is how fast do you eat? When you're taking spoonfuls and you're barely digesting it, you're leaving it in your stomach, body has produced even more acid to break it down. So what we say is, take a spoon, put your spoon down, chew, swallow, then take another. What that taught us was, you'll not eat as much because you'll actually get bored, the food will get cold. But number two, it actually helps with digestion. Okay, and you don't eat as much. Because you find the people who eat very quick end up saying, I'm still feeling hungry, so then I go. So you have to actually tell yourself you're not as hungry. Then another thing is, and I'm glad you can see the glass of water in front of us. Before every meal, take a glass of water. That fills up part of your stomach. By the time you're actually going to eat food, your body has already recognized that you actually have eaten something.
Well, just to get a bit of clarification on the drinking of water, you're saying we drink before eating. But with most people, we eat as we drink. You know, we eat our meals as we drink our water.
Why?
Is there any...
why do you need to do that? It's always, you want to push the food down, right? Why do you need to push the food down if you're chewing? You see, you have teeth, you can be able to chew. For the elderly patients, they blend so that it is smooth and it slides down. The purpose of chewing is to also help break it down into pieces that are palatable. The only reason you're drinking is because you're in a rush. And by the time you're eating food that feels that you need water, that means that you're taking solid foods, isn't it? You probably don't have a stew on the side, you don't have vegetables. As long as you're eating vegetables, they provide roughage, and that helps with digestion of your food.
So it isn't advisable to drink your water as you eat your
meals? Either
drink,
have a glass before, have your meal, and have another glass after. So you'll find we encourage about 6 to 8 glasses of water. But if you have developed any complications like chronic kidney disease, heart failure, then we will restrict your limit of your fluid, like such a glass to 3 glasses in a day. So because you're giving the heart extra work and the kidney extra work, so you'll find that it's not a blanket all, that for people who think we're essentially normal without any comorbids, then we say 6 to 8 glasses. So you drink your water, eat your vegetables, eat right. Now, there's a concept of, okay, we have birthdays and all. So we allow you that cheat day, but we say that if you're going to have a lot of starch, say over lunchtime, then reduce the amount of starch you'll have over dinner. The mistake we do as Kenyans is you're rushing to work, and so you'll nibble on the food. Then you have a very heavy lunch. Then because if you're a married man, she says you have to eat at home, or you've probably worked the whole day and you had a shift. At home, when you get home like around 8 p.m., that's when you'll sit down and have a really heavy meal. But what do you do after? You sit back and watch Vivian on TV, right? And then you go to sleep. Have you used up any of the calories?
Not at all.
So that's the concept. So we say your heavier meal should be during the day, say at lunchtime, and then do steps. One of the easiest things we tell people, you can say I have a smartwatch. Every 30 minutes it will tell me stand up, move around, just to get me active. If you can target 5 to 10,000 steps, WHO says ideally 8,000 steps, and that will actually make you healthier. That is how you start. But we recommend 30 minutes a day of exercise. But what we are saying before, it would be with, say, aerobics. That just keeps your heart going. But what builds your muscle, What burns calories is actually strengthening exercises. So that means lifting weights. So we encourage you to come, and then we advise you on how you'd go about it. And we're saying, let's move away from coming to hospitals only when you're unwell. Why don't you come for an annual medical checkup, and then you can be able to see where the problem areas are.
Yeah.
You know, there's a new concept of body fat composition. Before we tell you, if you have you look like you have an excellent BMI, 22, not a problem. And anyone who has a BMI of more than 25, we'd say, okay, you just need to go to the gym. Now with body fat composition, it tells you where is the fat stored, what is your lean mass, what is your water composition, and then we now tell you how much to drink, how much to exercise, and what to eat.
Okay.
Yeah.
I want us to remain on the diet
Yes.
a bit longer, you know, because it's really important, and it's something that most of us really don't. Yes, we eat, but we really don't look into what we're eating. And sometimes we do, but we don't really understand what it is, because I mean, with the fruits thing, it's still
Baffles the mind. How
mind-blowing for me,
fruits
because
are
I
healthy.
mean, they told us it's healthy to eat your apple a day. So when we talk about fruits, you've mentioned the ones that have really high concentration of sugar.
Yes.
So what fruits would you recommend for someone who's looking to just watch on the amount of their intake, their sugar intake rather?
So the ones first that have what we call a high glycemic index are things like your watermelon, your oranges, especially your mangoes when in season, the pineapple fruits, and the passion fruits. You notice most of them are citrus, they have a high sugar load, so that's something to think about.
All right, I'll ask you to hold that thought.
Yes.
We take a break, and then we'll come back and you'll get to explain that more.
Okay.
We take a break, we'll be back in a moment.